Honorable Magahaga, Governor Leon Guerrero, as well as our Lieutenant Governor, the Honorable Joshua F. Tenorio, our Public Health Director, Art St. Augustine. We also have with us in the Zoom room, we have Suzanne Kineshiro, Dr. Suzanne Kineshiro, Dr. Jana Miglotnia, and Dr. Ann Pabutsky, all from the Department of Public Health and Social Services. I now like to turn over the microphone to Governor Leon Guerrero for her opening remarks.
Thank you, Crystal. In the past week alone, we have confirmed 90 cases of COVID-19. Half of the month, we have seen 121 new cases. Numbers we haven't seen since the beginning of this pandemic. While we expected to see an increase in confirmed cases as we enhanced our contact tracing and testing capacity, the increase is very alarming and very cause for concern. We have also seen a rise in our hospitalization rate. Last month, we averaged 1 to 2 hospitalizations a day. Today, we have 8 COVID-19 patients at GMH, 1 in ICU, and 1 on a ventilator. This situation is very serious, and no one should doubt how vital it is to wear a mask, exercise social distancing, and stay home whenever possible. In consultation with public health and the physicians advisory group, I have determined that it is necessary to place Guam under pandemic condition of readiness 1 on an interim basis to protect our community from continued spread of the COVID-19 virus. This is only temporary for a 2-week period at minimum, and we will lift restrictions based on what the data tells us. If the numbers start coming down, we will certainly revisit and certainly move forward with lifting restrictions. Effective after midnight on Saturday, August 15, 2020, the following restrictions will be implemented. All non-essential businesses will not be permitted to operate. All public gatherings will be prohibited. All public and private schools will remain closed for in-person instruction, and public parks and beaches will be closed except for individual use like exercising. While we will be in PCOR 1, I urge everyone to still go to the doctor and schedule your medical appointments. We are entering flu season, and multiple medical conditions can overwhelm our healthcare system. To the people of Guam, I want you to know that this decision was not made lightly, and I've re-implemented these restrictions in order to keep our island safe and healthy. Based on information collected from our contact investigation team, 65% of our recent positive cases are our youth. Many of these new cases were also traced to social gatherings at places like funerals, bars, restaurants, the beaches, and so forth. And we do know that people were not wearing their masks and did not practice social distancing. Life should not feel normal right now. Every time you think about meeting up with someone, ask yourself if it's really necessary. And if it isn't, please don't do it. When you're out shopping, try to consolidate it into one trip to minimize your exposure outside. Social isolation does not mean you can go to your friend's house. When you do go outside, go on your own. And if you're elderly or belong to a vulnerable group, please stay home. This is about our families, our friends, our neighbors, and our entire island community. But we all must take personal responsibility for our actions. Each of us has a role to play in fighting this virus. This pandemic continues to demand courage and resilience from our island. The virus has caused fear and sacrifice throughout our community. But I know our people, and I know what we are capable of. We will rebuild again our economy. We will get our people back to work, Guam will be stronger than ever, but we just as we did before. Thank you.
Lieutenant Governor, if you have any words.
I just want to ask the people of Guam for their patience and their cooperation over the next 2 weeks as we really try and reduce the amount of infections that our island and our people are facing. And for all of you who have been sending your prayers both to the governor and to myself, while we have our own individual battles with the virus, I want to say thank you. I guess maybe I'll just add, right now I have some flu symptoms. I'm fortunate that they're not as serious as others, but you know, this is, quite frankly, I'm in the beginning of my journey on this one. And so thank you for all your prayers, and look forward to seeing you back out when we're clear.
Director St. Augustine.
Hi, good afternoon. Good morning, everyone. With regard to the need to move back to the PCOR, it is essential. It is essential, as just as the governor has indicated, just this month in August, data as of August 13 puts us at 121 positive confirmed cases. That puts us at 25% of the 477 confirmed cases since March 14, when we first got our first confirmed COVID-19 positive case. And so we ask our community to step ahead as we did in the past. Please wear your face coverings, wash your hands, and practice social distancing. We need to continue to be vigilant and not let our guard down. We were at a very low rate of positive cases back in May. We had 27 confirmed cases in May. We can do this again as a community, as the governor's giving the orders to again restrict movement for 2 weeks. We look to the numbers hopefully being reduced, and we look forward to, again, hopefully after 2 weeks of data observation, hopefully we're looking at a reduced number of positive cases that, again, the governor can look at reassessing and changing the PCOR status. But for now, this is essential for our safety and the health and preservation of Guam as a community, for all our families and all those that we love.
Thank you, Director St. Augustine. We'll now open the floor for questions from members of the media. Up first, we have May Habib from PNC.
Half a day, everybody. Thank you so much for your time. Governor, Lieutenant Governor, I hope that you are recovering well. I guess I'm just wondering, you know, PCOR 1, what will that mean for incoming flights? We're seeing that a lot of the numbers are actually being found in quarantine, and they're coming from the continental US or other areas. So what does that mean for incoming flights and for quarantining?
We still remain the same. You know, they have to come in with a PCR of negative if they are negative. If they are in the not in the low risk, they would have to bring in a PCR negative test. And if they are negative, they will go to self-quarantine. I also have to mention that when you are in self-quarantine, please stay home. We have found through public health contact tracing that people who are self-quarantining are not really complying to the rules of self-quarantine. And so I encourage everybody, and I plead with everybody to please adhere to the self-quarantine requirements and regulations. We've seen people, the people that we're seeing that are coming in is from high-risk areas, from the United States, from California, from Texas. And like you mentioned, we were able to catch positive cases through our quarantine. So our quarantine is working. We're also able to catch through contact tracing these positives. And public health is doing a good job and also following up other contact traces. So like, for example, May, if you are positive and you had a list of people that you had contact with, they will call those people and also they will test them. And that's how we're finding these positives. And so we're trying to, the end goal with that is to remove them from the community and isolate them and quarantine them. But we need your support, and we need your commitment to stay home for the period of time that you are to quarantine. This virus is very serious, very contagious, and is very persistent. And we don't know how it evolves either. So in protection of our people, please, I am pleading with our people to adhere to what we have sent out as directives. This is why we are where we are today. There were a lot of people that were non-compliant, not wearing their masks, even with families. So we need to just reset, go back, and reinstitute all those measures again, and have people please follow them. So your question, May, it continues to be what it is.
So thank you, Governor. And I guess to follow up from that, if you're saying it continues to be what it is and there's a list of low-risk countries, are we still looking at that 5-day implementation policy for people coming from low countries, which some of them are our tourist source markets? Does that still stand?
Yes, and just for information, there's hardly any travelers in coming from those areas, because they are also being asked not to travel.
Okay, thank you, Governor.
You're welcome.
Next up, we have Steve Limtiaco from the Pacific Daily News.
Yes, hi. Good morning, Governor.
Good morning, Steve.
So far, you've adopted a very targeted approach to containing the virus. Opening and closing certain types of activities as necessary. So, do you still believe in that approach? And if so, why is the island moving back to step one if the government has identified these cases to certain types of activities?
Okay, so the reason I'm doing it is this. I still believe in terms of recovering about this strategic, methodical opening. Right now, we're not recovering. We are now responding. We're responding now to a crisis, Steve, that's even worse than when we started this pandemic. And so to have a comprehensive and complete restrictions again is what is necessary to just stem and curtail and cut off these exposures to our people. And so I feel that not doing all these restrictions is going to be a piecemeal, slow process of response. So the reason we were really good when we first started is we quickly responded and we quickly closed. That's what we need to do now, because as I have said, we need to put in all our armaments and just battle this virus seriously, intensely, and aggressively.
Okay, and as a follow-up, so do the past public health memos still apply in terms of defining what essential or non-essential businesses are?
Yes, the guidelines, just off the top of my head, grocery stores are still open. Convenience stores will remain open. Home Depot, Kmart, Cost You Less will remain open. Curbside farmers market will continue on. Medical clinics will remain open. Pharmacies will remain open. Banks, credit unions, gas stations will remain open. Construction industry will remain open, ongoing. So it's not a complete closure. We're allowing those essential businesses and activities that are necessary for our quality of life: hardware stores, grocery stores, and so forth. But yes, if you go on the public health website, you'll see those guidelines.
Thank you, Governor.
Hey, Gov, can I just add, that's Dr. Cruz, that, because it's a question that's being asked for me as well, is elective surgeries would proceed as well.
That's correct.
Yes.
For those of you that don't know, that's Dr. Mike Cruz, our state surgeon, and also from the Physicians Advisory Group. Steve Limtiaco, were you finished?
Yes, thank you.
Moving on, Nick Delgado, Hit Ready 100.
Happy day, Governor. Happy day, everyone. Hope you're all feeling much better. You look well.
Thank you, Nick.
And so, Governor, with the restrictions that you stated, now that we're back in our PCOR 1, I'm wondering what happened to some of the criteria that was established previously back in March, and those being set aside. For example, I believe it was the road closures and other activities. Are we going to revisit any of that?
Road closures? No.
And some of the other criteria that was set aside or have been set aside?
Like what, for example, Nick?
That's what I'm wondering. Is there any other criteria that we decided to set aside and not implement in PCOR 1 this time around?
And will not implement in PCOR 1?
Yes, Governor.
No, not that I'm aware of. Like I said, we'll have non-essential businesses, as I mentioned, will be closed. And then those essential businesses that you've mentioned or that I have stated will remain open.
Okay. Will there be a release of the places that I guess both you and the Lieutenant Governor and others through the contact tracing, will there be a list of that be published for the community?
A list of places that had positive contacts?
Yes.
Is that what you're asking for?
Yes, Governor.
I don't know. We can ask Art. I think for the most part, if they needed to get people that have been in contact with a positive person and they can't get a hold of them, they'll make those announcements. That's what has happened in the past. Do you want to add anything, Art?
Sure, Governor. Nick, with regards to disclosing the establishments that any positive case, a confirmed case, has visited, that actually is a question that we're discussing and we'll be discussing with the Office of the Attorney General. We're looking for legal guidance if we can disclose the name of the establishment and if that is something that we have the authority to do. I recognize, and it's been raised in the past, that public health has issued names of establishments, and today we're not doing that. And until we get a formal legal opinion from the AG's office, we'll be not disclosing until we get an opinion.
Okay, so waiting the opinion on that. And just to follow up on the first question, Gov, in terms of the criteria for PCOR 1, another thing that just came up was, I know back then we had to have a specific amount of hospital beds available and testing capacity at the time. Yes. And so is that the criteria that we're at again? Or?
Those criteria are criteria that we were using as a guideline if we wanted to move from PCOR 1 to PCOR 2. Because in moving from PCOR 1 to PCOR 2, that allows us to lift restrictions and open more activities. And in order for us to feel comfortable and feel like we are monitoring very carefully, before we do that, we need to make sure that our contact tracing is robust. We need to make sure there's testing capacity. We need to make sure hospital space is there, and of course, looking at the cases, the test cases. And so right now, though, Nick, we're not in recovery right now. We have to respond. We have to go back and respond quickly and, like I said, aggressively. And once we do that and we see what happens in 2 weeks with the data, I'm hoping, because we have done it, I'm hoping that when we institute this, that people will comply and will adhere, and I'm hopeful that our numbers will start coming down. And so when we see that, we'll be able to feel comfortable again opening activities and opening businesses and so forth. So to me, I'm giving us a 2-week period, and I want everybody to get on board, and let's just all together fight this virus within the next 2-week period, and we will see positive results. You know, please, again, wear your mask. If you don't have to be outside, don't be outside. If you don't have to go anywhere, don't go anywhere. This is the only way we can beat this virus. I was just listening to MSNBC, and there was an epidemiologist there, and you know, he's saying our vaccine is quarantine, our vaccine is the mask, our vaccine is social distancing, and our vaccine is sanitation and hand washing. So, and they have shown that you could save lives as a result of that. So again, I can't overemphasize the importance of adhering to those measures.
Thank you.
Gov, it's Crystal. Just to remind you that we are allowing non-essential retailers to operate with curbside delivery.
Yeah, that's in, I think, in the EO.
The EO is forthcoming. Thank you, members
Yes.
of our meeting. Thank you, Nick. Next, we have from the Guam Daily Post, Heidi Eugenio Gilbert.
Good morning, Governor. Good morning, Lieutenant Governor. I hope you're feeling better today.
Thank you, Heidi.
My question is, with Guam back to PCOR 1 and unemployment or displacement of more than 35,000 workers is expected to continue, will Guam find a way to pay the 25% cost of the new Trump-ordered unemployment benefit to help out the private sector workers? That's the $100 per $400 in added unemployment benefits.
Right. So I just need to inform you that there hasn't been any guidance yet coming out from the White House. I know that it hasn't really been implemented in any of the states, the 75-25, because everyone does not, all the states are saying they don't have the money to do that. And the way that's going to work, Heidi, is the 75% is going to come from FEMA, from the Disaster Relief Fund. But the way FEMA works is you have to front those monies first, and then you get reimbursed through FEMA. And if we're going to front this money plus the 25%, it's going to cost our government $240 million. So we don't have that in the CARES Act, and we don't have that in the general fund. So that's a major increase in funding. I also want to let you know that although we don't have the federal PUA, we do continue on with the pandemic unemployment insurance of about a maximum of $345 a week for all those that have already applied and were getting the unemployment benefit. So there is still some funding and some financial aid through the pandemic unemployment. The federal one is the one that had expired. And I know that Congress is really working hard to be able to continue that portion with our people, not just us, but throughout the whole United States, because they are actually worse off in terms of their economy. Every state has been impacted, and Congress is looking very closely to help out again the American people, and also will include us as the U.S. territories.
Thank you, Governor. My follow-up question. So the 2-week PCOR 1, does that end on August 28th or the 29th? And if so, will the primary election be moved from August 29 to a later date? And have you already voted early?
I have not voted early. I am allowing the August 29th primary election to move forward. Of course, we are going to have to make sure we are adhering to those measures, social distancing and wearing your mask. And I know that the Guam Election Commission is preparing for that. And the reason the dates have to be at the 29th is because it's a timing of getting the ballots out for the general election.
So, Governor, will early voting continue even if we're under PCOR 1?
I don't remember if we decided to do early voting or not. Do you remember, Josh?
I think that the question might go to the Election Commission because they've been sending out some messages or an indication that they may suspend, but I don't know if the Election Commission has made a final decision on that yet. But I would just encourage them, since they are and I might add, as a former commission member, I would just encourage them. They have been using all of the precautions, and they've been practicing very safe practice for early voting. And I would ask them just to review what they're doing. If there's any improvements that can be done, including letting people just stay in that car under the tent, then I would encourage them to do that. But Heidi, I think you'd have to ask Maria Pangilinan that question, since the Election Commission is autonomous from us.
Thank you, Heidi.
Lieutenant.
Next, we have Nestor Lacanto from KUAM News.
Thanks, Chris. Good afternoon, everyone. Governor, let me just follow up on what Steve had asked you about. There are still very many in the business community that view this as unnecessarily harsh. I mean, we went from PCOR 3, skipped PCOR 2, and we're back at PCOR 1. And granted, it's only 2 weeks, but for businesses that are already on the edge, 2 weeks could mean a death blow. So how do you respond to those companies who played by the rules? They did everything that they were told to do to make their businesses, healthy. And now all of a sudden, they're going to be forced to close for 2 weeks.
Yes, I say to those corporate citizens that have been adhering, thank you so much, and appreciate that you are committed, and appreciate that you are supportive, and appreciate that you are helping us keep our island safe. I thank you for that, and I wish everyone would be like that, but it's not the case. And so my whole approach here, Nestor, is that we need to just completely have one intense attack on this virus. And we need everyone, all our community members, to be part of that battle. And so having selective and targeted closing is slow. We need to act fast. Otherwise, this virus will take over our island. And that's where I am coming from. And it's unfortunate that this is where we're at right now. I was hoping that we would never get to this point, but I can't close my eyes and say, oh, really, it's not happening, because it is happening. And in order for us, again, to resolve it, we have to be all together with all the bombardment that we can to fight this virus.
So, Governor, just what specifically do you hope to achieve in just 2 weeks' time then?
This is what I hope to achieve. I want people to understand the seriousness of this virus, and I want them to get on board and do everything they can to fight this virus. I want them to get a very serious attitude about this virus. Nestor, I have been in restaurants, and I'm not going to say which ones are they, that they don't even put their mask on when they're not eating. I have been to a restaurant that had a bar, and that whole bar was not wearing their mask. I have been to funerals where they're not wearing their mask. I have been to funerals where people are outside smoking and socializing and not wearing their mask. And these positive cases were traced back to funeral homes, and they were traced back to bars, and they were traced back to restaurants. So this is serious business, and I want to make that message and impress that on our people. The other thing that I'm looking at is, of course, decreasing the number of positive cases. I would like us to see again positive cases. I would like to have 0 positive cases, but that's not going to happen. But what I would like and hope to see is that we at least go back to what we were doing before August and July, which is about 1 to 2 per day, some days 0. And our positivity rate was 1.2, 1.3. Right now it's 2.9. That's a double increase in our positivity rate. Again, our hospital, I worry about our hospital, Nestor, because like I said in the beginning, there were 121 positive cases in just half of the month of August. 121. I don't know where those positive cases are going to end up, but I'll bet you some of them will end up in the hospital. Like I said, we only have certain number of beds for COVID, and we have certain number of beds for ICU, to the point where I am very worried. I've been communicating with the Admiral, and he is prepared, if we need to stand up the hospital tent and to bring back medical professionals that will help us. This is how drastic this thing is. It's not something lightly. And believe me, the decision to do PCOR 1, Nestor, I've been thinking about this the last 2 days. That's all I think about, you know? And I feel really good that this is the right decision for at least 2 weeks.
All right, thank you, Governor. If I can squeeze in one more, have you gotten any indications then that the trends of like yesterday 28, the previous day 26, is that continuing?
Well, we'll have more numbers, but yesterday, public health gave me 2 positives, right? But then they informed me this morning that there were about 15 or 18 more from Naval Hospital, and they're looking at possibly 47. They're re-looking at all those numbers to make sure that they're cross-referenced. But for me, absolutely not. I was really happy when I heard from public health that there was only 2 positives from their labs out of 286 samples, right? Because that's normally how it is happening. But then when you get the numbers from Naval Hospital, from GMH, from DLS, those numbers go up. And so what we're going to be doing is we're going to be doing community outreach every Saturday in the next month, in this month, and for 4 Saturdays in a row. And you bet that you'll see more positive cases there.
I just wanted to add that through contact tracing, people are getting tested as we speak. Long lines up at Tenorio Public Health is what I understand. I have members of my family that are in line waiting to get tested. And I just wanted to add that, you know, for us, even in my own meetings with the governor and her chambers, we wear our mask. We wear our mask in every single meeting that we have. I think maybe except for one time in the last 2 weeks, had I gone out to eat, but usually go straight home. And so I think the message I want to say is that the virus is very contagious, including when you are taking the highest of the precautions. And I think that the outcome we're looking for is to flatten this curve. It is a very, very steep curve with an upward trend over the last few days. And I think the director, San Agustin, will tell you that these cases that we received in August, with half the month not complete, is nearly 25% of the total cases since March. So I would think it's very obvious to everybody, and quite frankly, for the majority of the people of Guam, that swift and fast action needs to occur, and we've made that decision to do that.
We are also, Nestor, in a high risk, we're considered a hot spot right now, according to our CAR score. So we had a CAR score of about maybe 4.8, 4.9. Our CAR score right now is 8.3. This is in the same line as some of the states.
Thank you, Nestor. Moving on. Maureen Maritita, Mariana's Business Journal.
Buenas, everybody. Hello, Governor, Lieutenant Governor. Best wishes to both of you from me and my family.
Thank you, Maureen.
Aside from that, I'd like to clarify a couple of things in my first question. We were saying that non-essential retailers can operate with curbside delivery. That means that although restaurants are closed, takeout is still permitted?
Yes.
Okay.
It was takeout was permitted even in the previous PCOR one. So we're using the same public health guidelines. The one that is new is the retail curbside. And actually that was a good recommendation from Holly. And New Jersey is doing that, where you can, I guess, shop online, and then they'll do your orders, and then you can pay online, and then they can, you can come and pick it up. And what New Jersey does is they call the store ahead of time to let them know that they're coming. And so I thought that was a very creative way of still maintaining retail business, but at a very, I think, very guarded manner.
And as part of that first question, what about the government of Guam offices? Which ones will be?
We have held off customer-facing operations, but they're still, we have asked them to telework. So they're still in work mood, but through teleworking.
Just to stay with that, that didn't do so well for the for people that wanted services from, say, the Department of Revenue Tax, right? Because there's such a backlog that their capabilities are so low that there really wasn't much telework resulting.
So we were, I think Daphne is trying to look at it in terms of doing appointments instead of just walk-ins to kind of decrease the volume. And hopefully that would help, and that would help us with the backlog of driver's license. I know that vehicle registration is up to date. We're also in discussion with the Lieutenant Governor to see if we can just go ahead and issue a license for all those, say, who expire in 2020, and issue them a license till 2021 without having to come in. So that's some of the discussions that we're looking at. No decision has been made yet, but in the hopes of decreasing volume and helping catch up, that maybe that would be a service that we would do.
Thank you, Governor. My second question. So what happens in 2 weeks if our numbers don't reduce, and in 3 weeks if they don't reduce, etc.?
Then what happens is we continue on, because it's not, because if the numbers aren't going down, then we need to just stay on course here and make sure that all the things that we are doing, and people are, again, complying, so that we can decrease those numbers. Maureen, it's unfortunate, but that's where we're at.
So there's no middle ground. The numbers either have to be 1 or 2, or
like, for example, you know, if we're seeing 25 a day and we start seeing 8 we start seeing 10, there has to be significant decrease, and that's sustained in 2 weeks. Then yes, of course, we will look at what we will start opening again that is less risky in exposure. But Maureen, if we start seeing 30, 25, 40, that's not good.
Thank you,
Thank you,
Maureen.
Governor.
Pacific Island Times, Johanna Salinas.
Half a day, everyone. How are you feeling, Governor and Lieutenant Governor?
I'm doing good. Thank you, Johanna.
I'm okay.
All
Not the best, but I'm okay.
All right, all right. Okay, so that's good to hear. So, have you identified the weak points or any area in the COVID measures and strategies that might have been overlooked and caused the widespread contagion?
Can I go at that first? I think one of the things that we saw, at least from my understanding, and Director San Agustin can correct me, but these 2 funerals, that had a wide number of cases associated with them, the evidence may be that it was family members that came in from off island that had cleared quarantine because they came in prior to the escalation of the quarantine rules and the pushing of the mandatory PCR tests. But at least some of those cases, it seems that happened. And I want to say that the Physicians Advisory Group, and based on their data analysis, we stepped up and placed more limitations on quarantine and reduced a lot of the I guess pathways to go to self-quarantine when it was inappropriate. And so that helped. And I would say that might be one area that we started seeing was a problem, but took some swift action. But of course, at that point, when the infections occurred and people are hugging their family members, staying in their family members' homes when they were really visiting, it caused some problems. And maybe I pass it on to the Gov or to Dr. Mike Cruz. But that's one thing I would say is that the quarantines measures were increased as a result of looking at that occurrence.
I think also we must tighten up tracking of self-quarantine people. And that's something that public health is looking at. They're also looking at an application that can be uploaded in their phones to trace and track where the people are. So I think we can do tighter controls in the self-quarantine part.
Okay, so besides the tighter controls and the curbside delivery, what are other things that will be changing or that you'll do differently during this PCOR 1?
I don't know if there's anything.
I think more testing. I know is the testing capacity that we have in this PCOR 1 is greater than we had in the last PCOR 1, and that yeah.
And also more contact tracing. But the Lieutenant Governor is right. I was going to say, I don't know if there's anything more other than reinforce and enhance already the situations and the systems that we have put in place. Art, do you have anything, any addition to that?
Governor, Lieutenant Governor, actually, you're both on point. Definitely, we are looking at software applications that would help us with monitoring and tracking and tracing those that are returning to Guam or doing home quarantine. Also want to say that the new protocol that we worked through with the PAG is working. The quarantine facility is working. You have 2 categories. It's either low risk or non-low risk. And in order to go to the home quarantine, it would be with an acceptable negative COVID-19 test. So We are looking at our current system. The governor and lieutenant governor have articulated what we need to look at as a health department, and we are working on those two areas to tighten up our process. So that's what we're doing at this time. Thank you.
Okay, thank you.
Thank you, Johanna. Last but not least, Tomas Maglotnya, KUAM's The Link.
Good morning, half a day, everyone. Wishing you well, Governor and Lieutenant Governor. I wanted to follow up on the timeframes at which PCOR is established. As we reported on KUAM and on The Link, PCOR 1 by the numbers lasted about 58 days initially, PCOR 2 around 71 days, and PCOR 3 around 24 days. Is there a reassessment on these timeframes at which PCOR levels are implemented? As we've also heard from some officials, we're 6 months into a pandemic that could last 2 years.
Right. And that's why we always have to be constantly testing and constantly monitoring and constantly working with whatever the challenges are that come as a result of it. You know, Tomas, some of the experts say this virus will eventually evolve as like an influenza, where it's going to continue to be part of our community. But I don't want it to be so infectious. I want it to be, if it's an endemic, that means we can still live with it and not being real sick. And so if that's the evolution, then that's something that we will have to contend with in terms of how we go about with our business.
So are you reassessing the timeframes at which PCOR levels are implemented? Is it going to continue to be on a 2-week basis?
So for the immediate course of action, I have put it as 14 days, because that's usually the course of the virus is over 14 days. So so I'm giving it a time frame of 2 weeks, because we already know what the drill is, right? It's not like when we started, we didn't know where this virus is going to take us. And so we didn't have also all the capacity that we had for testing and so forth to know exactly what our community spread is. So now we have those. So we're able to understand and get more information about our community spread. And so we will be continuously monitoring, like we always have, the data.
And speaking of data, for my last question, is there going to be new formulas or models implemented? Is there going to be any change in the assessment given the numbers and this reversion back to PCOR 1?
I don't think so. I think the models and the data that Dr. Cabrera has been giving us has been very accurate. It's been very on point, and it gives us a lot of good information to justify the decisions that we have made. So I'm not aware of any new ways of calculating the data, only maybe to refine it a little bit. But the measures and the metrics that we're using is very adequate to our decision making.
And midnight is midnight at 12:01 tonight, right?
No, tomorrow.
No.
Yeah.
12:01. It's 12:01 a.m., which starts tomorrow, Saturday morning, late Friday night. Tomas,
Yes.
I just wanted to add one of the other factors that I feel is the change in PCOR 1 situation is, we have the cases in the United States have just skyrocketed. And unlike in PCOR 1, when there was very limited travel from returning Guam residents or family members, on average every day, there are about 150 people that come into Guam from the United States. Hawaii right now has hit their record number of cases ever. Especially in this last weekend. They were one of the last ones to hold out. They're now one of the most they're the ones now have one of the highest infection rates. And so we're obviously living in a small island, but we have a lot of threat coming in, unfortunately, from people that we know and love. So I just want to ask people if they can reconsider their travel and to reconsider or discourage their family members from coming into Guam. This really is not a time to risk it. Their essential travel sometimes is necessary, but let's face it, just hold out. The situation in the United States is not getting any better, unfortunately. And what we're experiencing right now in many ways is influenced by all the lack of measures and controls in the continental United States. That's one of the realities that we have.
Right,
I
thank
just
you.
wanted to add, I also wanted to add that if you talk to people at public health, we had really internally within our island contained the virus. But then, like the governor was, Lieutenant Governor was saying that as we get these travelers coming in, we get infected from outside sources that is coming primarily from the mainland.
Governor,
Thank
can
you.
I just add also that any discussion on time frames or time periods, this is the virus's time frame, and that's not something we can predict in any way. And so, that we react to what was thrown at us, and under the abundance of caution, the PAG agreed that we needed to get aggressive and very effectively and efficiently stamp this out, and hopefully can get back to a state where we contain the community spread, and then maybe continue to focus our efforts on any arriving infections that are coming from other places, such as the mainland U.S. and others. And so, one other thing I would like to add, and maybe this is something you did discuss, is the need to enforce the violations of any protocol or quarantine, breakers. I think that people need to get serious about this, and that if we're going to do this, we do this all together as a community, and we suffer together as a community, and hopefully we can get this thing contained. But we need to take this seriously, and that violators of quarantine and violators of protocol, I think, need to be taken to task.
And that is included in our executive order. So,
Governor, do you have any closing remarks, or Lieutenant Governor?
I just want to again say that it's unfortunate that this is where we're at today, but I really believe with the work, the cooperation, this commitment, and the support of all our members of the community, that we can rally up together in a united front to again fight this virus and contain it, so we can move to a much better normal life, as normal as whatever that definition is now. So I just wanted to say, please make sure that we continue on with all those measures that we have been putting forward, and don't do social gathering. If you are even with your family members, just wear your mask.
Thank you everyone for joining us. Have a great day. The EO is forthcoming.